Hi guys, how are you? So welcome to my eighth session. I had recorded this like an hour ago, but my baby and her son really decided to distract me. So I thought, okay, fine, let me just reschedule it until I'll have sorted them out so that we can talk about this very important topic. So I was telling you I was going to talk about vaginal dryness, and these are basically questions that I coiled from social media, like from Facebook, from Instagram, and from TikTok. Like I have seen a lot of posts about vaginal dryness, and they're not even coming from men alone. Of course, there's a group called PCOS Warriors on Facebook where I have actually seen a lot of posts from women struggling with hormonal issues, PCOS, and other complications actually seek for remedies about vaginal dryness. Of course, these posts, majority of them are usually posted anonymously. And I've also seen men complaining about their women's and their wives' vaginal dryness situation. Like the main reason I decided to do this topic was because I read a post on Facebook. There's this guy called Commissioner, and the post was about a man complaining about the way his wife, vagina hurts his penis every time they have intercourse. And instead of looking for solutions or trying to come up with a way to actually address the issue for his wife, he was looking for another woman. And unfortunately, from the comments section, there was a lot of men supporting that it's okay for him to do that because apparently they have been doing that. So when the mama is struggling with the dryness, they go look for another woman, which is not good because it is building on the esteem issues and the challenges that your woman is actually struggling with. And from the comments also from the ladies, it was very clear that majority of us, I know we are the ones who struggle with vaginal dryness, but we don't even know what exactly vaginal dryness is. That is why I have this 11 questions that we are going to talk about together. So this was supposed to be a discussion. My friend, they have a power situation, but she'll be in next week, so we can continue the discussion then. But here we are going to just do the Q&A of the common questions that I coiled from that. I'm also having my buyu, what you call baobab, so that my lips don't dry up. Hormones are all over, over here. Anyway, so the first question that I'm going to talk about is what exactly is vaginal dryness and how do women know and they are experiencing it? Because as I've told you from the comments, hatujijui, we don't even understand our bodies as women, and we need to improve. So, vaginal dryness is basically the reduced natural lubrication. You see, if you are a woman of reproductive age, let's say 15, let's be a bit realistic, they're starting from 13 nowadays to around 49 years old. That means your body metabolically and through your hormone profile is actually still supposed to be supporting natural lubrication for sexual intercourse. And before I forget, the day I was having an interaction with some few people, maybe a bit older, and we're talking about vaginal dryness. And it came out of nowhere, completely out of nowhere. And someone said, if you're a woman below 40, like, and this were men. These were men. These were men. For a woman below 40, the natural lubrication is sticky, it penetrates well, people don't get hurt, there's no room for injury. We're going to talk about some of the myths. So, and another one said that after 40s, in your 50s, now yes, you might get wet, but the lubrication might not be favorable for penetration. And in as much as I want to dispute this, there's a lot of changes that happen to our body as we age, but worry not, because we are going to talk about the remedies as well. So basically, when the natural lubrication reduces, it can be due to hormonal, as I've said, hormonal and physiological changes that happen to a woman's body, or it can be caused by lifestyle factors. You can be smoking, you can be drinking too much, you can be eating a lot of refined foods that do not support metabolic health, that do not support your endocrine system, that do not support your liver health. And these all actually have a negative impact on your hormones and definitely on your vaginal or your reproductive health. Some of the common experiences that women have who are actually struggling with vaginal dryness. Of course, if you're dry, you will experience pain or discomfort during intimacy. And sometimes you'll also experience burning, itching, or irritation in your vagina. And this comes with recurrent infections. It can be UTI, it can be BV, it can be all that. And something that women like to be told, or they like to tell themselves, you might also feel too tight or get inflamed during intercourse. You see, again, there's a post I read somewhere. This is a post, this was not a discussion, that now they're feeling tight, where women confuse dryness with tightness. And that post again, nowadays people are shameless. The most comment, but we thank God for anonymous comments, because the comments were anonymous, majority of them. People were saying that women actually confuse. They think that being tight is being sweet, and I quote. Now, from a man's perspective, because me, I like knowing, they like asking questions. If you've met me, you know I will ask questions. From a man's perspective, sweetness comes from the lubrication, the wetness, and the reception. Now, how is that reception? Of course, the muscle tone in your pelvic actually really matters. I'm not saying that now you start ignoring your muscle tone, but let's stop chasing that feeling of being tight. When we were in campus, now I think I'm going to share a lot of stories today, but it will not be long because I want it to be exactly 1 hour. But then, mabu is a good source of vitamin C. Just the coloring might not be good, but you cannot have everything. Of course, I can have the white one without the colors, without the sugars, but from where I am, this is what I could get. So let me tell you a campus story. When we were in campus, there was this story that girls used to lie to each other that ukieka soda huko chini, was it Coke or Crest? I think it was Coke. Ukieka soda huko chini, you become instantly tight. And I want to say it's a lie, because you see, when you put something as concentrated as that carbonated drink in your vagina, you're stripping your vaginal tissues you're stripping them moisture. And those will cause you dryness. And then when you engage in sexual intercourse, you'll feel like you're tight. It's safer for you to use clean water, pure water, to remove anything that you might feel like kama ni uchafu, or if you have things that you don't want to be found there, you use clean water and you remove it and you do your Kegels. I think with the discussions we're going to have with Grace, we're going to talk deeper into that, but it's very important. So one thing that we need to stop is actually idolizing painful sex in the name, or inflamed vaginas in the name of tightness or trying to please our men. You're not pleasing them, you're hurting yourself. And of course, if you get too inflamed, you get burning sensation, you get pain during intercourse, you're going to hate having the intercourse. So basically, that is on question one on what is vaginal dryness and why it happens. Now, the second question, people were saying that it's a millennial and a Gen Z thing where we are having the young women and young girls struggle with vaginal dryness. Now, let me ask you a question. Do you think that young girls struggle with vaginal dryness? Considering the fact that I've talked about, we have said that hormonal changes, physiological changes, and many other changes can actually contribute to the woman's body releasing or reducing the necessary hormones, that is basically estrogen, that actually help in vaginal lubrication. Now, do you think that younger women will actually still struggle or are actually struggling with vaginal dryness? Let me know in the comment section. And the common answer is unfortunately yes. Of course, there are different reasons as to why a younger woman would actually struggle with vaginal dryness as opposed to an older woman. So that is the second question. So we need to understand the body's response to things. Now, first and foremost, the level of stress is increasing rapidly in our women. We're going to talk about generally about the causes of vaginal dryness, but let's just talk about this one first. So stress is increasing in younger women. The modernization, urbanization, and empowerment of women. And of course, we also having this thing that is currently going around about restrictive dieting, under consumption of healthy fats, hormonal contraceptives, thyroid dysfunctions, and PCOS among younger women. Now, these are basically things that now disrupt hormones and bring about hormonal issues. And remember, we said that vaginal dryness can or is an issue that is directly associated with hormonal fluctuations. So when you undereat because you don't want to get fat, when you don't eat healthy fats, how are you going to produce the necessary hormones? If you're on restrictive dieting, like you're eating vegetables only, how are you going to get the energy to support your metabolism, to support your liver health, to support even your reproductive system, digestion, and all that? You know, you're going to predispose yourself to unnecessary issues like PCOS and many other hormonal issues. Again, recurrent infections and poor sexual behavior and habits. I know most people will not agree with me on this one because we want to say that we want to stay woke and we want to sleep with anyone that we meet. Yes, and you know, when I talk about irresponsible sexual behavior, you're sleeping around with different people and you're not using protection. This means you are increasing your risks of developing the UTIs, you're increasing your risk of developing the STIs and the STDs, and all these contribute negatively to vaginal dryness. So, one thing that we need to sell to our younger women is that safe sex is protective, not just from the diseases, but for the vaginal health. So if you don't drink water again, if you don't practice good hygiene, haujui kuiosha as we are usually told, let's try as much as we can to learn how to do it, you know. And when I was growing up, we used to be told that we need to know how to wash our vagina. And we had aunties, or my mom will tell me that currently everything people will rely on internet. So someone will go on TikTok and someone will tell you that you need to insert lemon water inside your vagina You need to insert sodas inside your vagina. You need to insert things inside your vagina so that it can be tight. You need to insert stones and many other things. So all these are contributing to the younger generation of women actually experiencing vaginal dryness, and that needs to stop. Let me know in the comment section your thoughts on that, because it is not just a menopause issue. It's not just a older generation issue. It is affecting younger women a lot. And before we know that it's dryness, our sexual health or sexual relationships, they have been affected. Maybe if it's not a marriage, someone has left, and you start wondering. Someone used to tell me, I don't know, let me just leave that there. But yeah, we need to take care of ourselves. So why is it becoming so common? We say that it's not an issue of older, it's an issue of cutting across all generations. First, it's becoming common because you see, I am a woman and I am talking about vaginal dryness. And if a woman listens to this and she's maybe experiencing some issues that are actually due to vaginal dryness, she'll get aware and she might start talking about it. So first, awareness has increased. That is the first thing. Now, the second thing, of course, is on the changing trends, where I've talked about high levels of stress. I've talked about PCOS and insulin resistance. But there, if you're struggling with PCOS, blood sugar irregularities, pre-diabetes, you need to check out the first discussion I did, where I talked about how to regulate blood sugars for women and why it's necessary. And of course, there's also the aspect of postpartum and breastfeeding hormonal shifts, where women are talking more about what they're actually experiencing. You know, kitambo, you will give birth and then your husband will just stay away from you for at least 3 months. And by the time you get, after 3 months, you're feeding well, you know, the foods are also good, you're feeding well, you're being taken care of, your hormones have stabilized. So most women will not even know whether they got dry or not. But now we are living with only our husbands. You give birth, the man wants to jump on you within maybe the 6 weeks or the 7, even less than 3 months. Your hormones have not stabilized. You've gone to the clinics, you've gotten hormonal contraceptives, maybe you've gotten them too soon. So you're having hormonal imbalances and shifts. So this again contributes to you getting drier than the traditional woman. And of course, there's also the aspect of maybe aging population and people are willing to talk. Like you're seeing more women in their 40s, in their 50s, creating content or even talking to younger girls so that they don't repeat the same mistakes that they were doing. I'm yet to come across one who's talking about vaginal dryness, but I think that is also something that we should be doing. Maybe I can start. And of course, the aspect of changing food trends. The other day we were talking about food safety and nutrient profiles of foods, the way it has actually drastically changed in the country. And this is not something that is only affecting Kenya. It is something that is cutting across globally. And this leads to poor nutrition and micronutrient deficiencies. Remember, we said that vaginal dryness comes from a result of metabolic health, hormonal profile, and physiological changes. And all these require nutrition and micronutrient, both macros and micro adjustments, so that we can holistically take care of our body so that it can be able to take care of ourselves and help us with lubrication. And of course, another thing, of course, is hydration. Are we drinking enough water? I know for a fact that I am. And one of the things that I liked about a comment that I read in that post was that when like that guy was advised by another gent, apart from the ones that are actually supporting the idea where he needs to get another woman, he told that guy, tell your wife if she's on a long-term contraceptives, she can have it changed or she can have it checked to see if that is the issue, and then you get her vegetables and fruits, and you encourage her to take water 30 minutes or 1 hour before intercourse. That was an amazing advice, because hydration is very important. If you are dehydrated in your mouth or in your lips, yeah, when again, these theories that we have, I have come across about vagina health and dryness. Someone says that if your lips are dry, if these lips are dry, the other ones will also be dry. Let me know what you think about that. But that is something that I've come across a lot. And someone will even, like, I remember, I think this is, but it's not bad. So it's good to share. I remember a discussion I was listening when someone said that he will know, or they will know, whether they are going to enjoy intercourse with a woman by looking at the moisture level of their lips. It's not the lip balm, it's not the lipstick, because you can apply very good lipstick and you're still dry. You can get even a good lip balm, but you're still dry. Of course, dehydration signs, we have talked about them. So we need to make sure that we are hydrated. Get something as huge as this. Drink at least 2 of them. And just watch your body, because again, when you're well hydrated, you're promoting your metabolic health, you're promoting your liver health, you're promoting your excretion, and you're also reducing the risk of getting those 2 infections that actually contribute to UTIs, because you'll be peeing more often, expelling the toxins. And also, when you're drinking the water, make sure that you're also taking care of your electrolytes. You see, that you don't get dehydrated. So those are some of the myths. So those are some of the stories that I've had about vaginal health, but I know there are dangerous myths out there. And as I said, remedies that women are actually trying, really trying so hard to get their vaginas tight and good for their men. And I'm not bashing you for trying or wanting to, but I want you to try and use or use strategies that will work for the betterment of your health. Things like using toothpaste, crazy detergents, or antiseptic inside your reproductive organ. It's not a good thing. And I know we have yoni herbs, we have a lot of herbs that we're actually, they're being sold out there, Medura sticks and all that, that men are told to insert inside so that they can get tight. Remember, I say that when you insert things that are going to rob your vaginal tissue of the water or their moisture, you're going to experience dryness, and you'll experience a feeling of tightness during intercourse, and you'll think that your man is actually enjoying it, and he might be getting hurt. So we need to try as much as we can to use just tuzione 18. Let's not jump into everything that we see people selling. And of course, there's also the aspect of overwashing and of vaginal steaming. It's okay to do steaming. I do sitz baths every once in a while. I sit on it once in a while, but don't overdo it. Don't overdo it. It makes your tissues more fragile and more prone to injuries. Again, it can rob your vagina of its natural moisture. And the do-it-yourself acidic mixtures, I told you girls were using lemon water. These are terrible, because the risks actually include a disruption of vaginal microbiome. You're ripping it off, actually with overwashing and the vagina steaming, unatoa, unaziua, and then this predisposes you to UTIs and other vaginal infections. So kazi itakuwa tu unashangaa. Unaweza pia jichoma, you can burn yourself, and there can also get irritation, and all this actually worsen dryness. So let's try as much as we can not to do that. So remember that your organ, it's usually self-regulating That means harsh interventions are not necessary because they damage the protective flora of the urethra. So let's try as much as we can to, of course, I'm not saying that now you go smelling and because you've not washed your vagina. No, wash it well. Wash your lips, wash your labia, wash the outer area because again, it's closed most of the time. And depending on the different stages that you are in life, when you, during your monthly cycle, you know, there's a phase where now you might need to maybe shower thrice or maybe wash your vagina maybe thrice or twice at least, that because of the sweating, because of all that, if you're pregnant, if you're breastfeeding and all this. So try as much as you can to make it clean, but not insert things inside. I don't know if I'm making sense. I hope if you watch that, you try and you leave that with this, you leave here with that, that will be good enough. So it's very important. So because I've talked about a lot about hormones and vaginal lubrication and health, can we just briefly discuss how, this is the next questions, because I commented anonymously also because I'm not trying to be seen, but next time I won't comment anonymously. I said on that post, I told that guy that your woman might be struggling with hormonal issues because he was like, she's young, she's still not yet 30. Why is he getting hurt? So I told her your woman might be struggling with hormonal issue. She might be having a lot of stress at the moment, and she might be having something that is just disturbing her mind, so she can't focus. So you need to be a bit patient and address the root cause. You're going to do that as well. So here is where I want us to understand how hormones are actually connected to vaginal lubrication. Remember, we said that after childbirth, you might experience it when you're stressed. You might experience vaginal dryness during menopause and perimenopause, or even due to poor dietary habits that can actually lead to hormonal issues. You might experience vaginal dryness. So we talk about estrogen, that is the main lubrication hormone, and this is the one that is known to maintain that moisture, hako stickiness, that clear sticky fluid that you want to be removing when you're aroused. Estrogen is responsible for that, and unfortunately it drops as we age. And of course, it's also responsible for elasticity, how your vaginal muscles contract and relax, and it also maintains blood flow into the vaginal lining, and this actually helps with now making sure things are running smoothly during intercourse. So when you have low estrogen, you're going to have a thinning vaginal tissue, and this will lead to reduced lubrication. So if you're struggling with vaginal lubrication and you've actually assessed, maybe you have low estrogen, or it's aging, or it's childbirth, the good thing with childbirth, as you wait or as you recover through nutrition and proper habits and lifestyle, your levels will grow back as you continue breastfeeding, or as the intensity of breastfeeding reduces. So your estrogen levels will increase gradually. But if you've gotten to the menopause and the perimenopause phase, of course, there are estrogen rings that you can get prescribed by the gynecologist, children around midterm, by the gyna or your physician, and they will actually help you in releasing estrogen in your body. Of course, there are other supplements. Again, we're going to talk about those. There are supplements that you can take to actually help with estrogen and all this vaginal health. But again, you also need to make sure that as you do that, you also take care of your insulin resistance, because remember, we have said that if you have watched any of my videos here, especially on women health, I have said that insulin resistance is a major contributor to hormonal imbalances. That is basically the androgen imbalances, like the production of high levels of male hormones, and this brings about hormonal disruption that affect the sexual reproductive health of a woman. And of course, the stress hormone that is basically cortisol. These are the 3 key hormones that you want to try and play with to make sure that you're maintaining them at good levels, either controlled or not too high, not too low, so that you can have better sexual health. Stress hormone, let's control stress because it suppresses reproductive hormones like estrogen and progesterone. Are we together? Are we together? And before we get to that, now we get to the next question. I don't know if we talk about supplements first. Now, supplements is part of nutrition, so we can talk about nutrition and how it can actually improve vaginal health. So, my question again, when you have struggles with your health, as majority of us, we will rarely go to a nutritionist because we will think that that's the last thing that we need to address. But if you're struggling with vaginal dryness or any other sign of hormonal imbalance, you need to be very intentional about taking care of your nutrition. Remember, there are mechanisms. I don't want to get deeper into it because I told you guys you're going to have Grace and have a conversation with her on this. But there are things like healthy fats that actually help with hormonal production, the importance of having a stable blood sugar that actually balances insulin and estrogen signaling, and this actually also helps with blood micronutrients, things like magnesium, things like zinc, things like iron, things like calcium, things like all these that actually help with tissue repair and circulation. So I think taking up foods that are going to support your hormone and hormone health profile, things like omega-3, sources of fats like fish, flax seeds, chia seeds, avocados, nuts, seeds, and phytoestrogen foods like maybe legumes, beans, kamande, green vegetables, those things that tunaambianga tu mkule, zinc-rich foods like pumpkin seeds, legumes, vitamin E sources, nuts, seeds. This is a good source, but ukivunja, when you break this seed, it has a very rich casosi fat that has vitamin E and also hydration. All these actually support hormonal and vaginal health, and not the crazy dieting things that people with things like PCOS or things like hormonal issues and metabolic health issues or blood sugars are actually being subjected to do crazy dieting that rarely works. So I think we're going to have a lengthy discussion with my friend Grace on nutrition and how it supports sexual and reproductive health. Can we have it in women? But we can just have it in both genders. So I think we're going to have that discussion next so that we have a continuity of this to make it a bit safe. Let's talk about supplements and herbs. When thinking about supplements, this is where now most of us are getting really confused because you'll be told to take ashwagandha, you'll be told to take peppermint, you'll be told to take wheatgrass, you'll be told to take maca, you'll be told to take leaves that sometimes you don't even understand where they are coming from. But whatever you're going to do with your supplements or herbs, just make sure that the herb or the supplement that you're taking supports your liver health. That's very important. Supports digestion. Another very important. Blood sugar control. And it's safe for your excretory organs. That's basically the kidneys. And apart from that, it's also great for your endocrine and thyroid or other thyroid system. Very important. So when you take a support, because supplements are supposed to support now the nutrition that you have talked about, when you take a support supplement or a herb that cannot explain how it's going to do this, then you're risking yourself and you're risking getting worse than when you do that. Of course, you can do micronutrient supplementation because you also need, remember that if you don't have enough blood volume, you'll not have enough blood flow to the vagina, and then you'll not get moist or you'll not get wet enough. So you need to now support anti-inflammation, because again, inflammation or chronic inflammation is one of the main reasons that we have a lot of hormonal issues. So of course, things like, as I've said, the omega-3, the vitamin D, vitamin E, magnesium, the probiotics and all that are great for actually supporting and controlling inflammation. We also have things like inositol that is also great for controlling blood sugars. We also have things like cranberry. Excuse just kidogo. Anyway, as I was saying, of course, strategic supplements that support nutrition can actually help a lot with vaginal dryness. I have like 10 questions, and this disturbances is a lot. So I think I won't talk about the role of stress because I have emphasized on it, but you can let me know what you think about how stress contributes to low libido, vaginal dryness, and poor sexual health in women. Of course, as I said, there will be reduced estrogen production, reduced blood flow, of course, fatigue and emotional disconnection. That is very common in marriages and in women because women are given a lot of work. If you want your woman to be active and aroused by you, try something like offloading her from some of the house chores and such. Get her help every once in a while that she can rest, she can sleep well, and she can take care of herself. So let's try kuchapa. Let's try and manage our stress levels as much as we can. And even it's good for emotional. It's good that you support your woman emotionally. Like some distractions, why are you doing that? Sorry about that. Now, on the lubrications, because this was really recommended in the comment sections, I really wanted to talk about it at the last. If I knew some people would come back and distract me, I would have talked about it the first point. As a question, do lubricants, gels, or cream actually work? When you think about it, of course, it's a yes, they do work. They are helpful to relieve the symptoms. But if you have followed through, I have talked about some of the things that can cause you to have vaginal dryness. So if you don't address those things like stress, poor diet, poor sleep patterns, use of things inside in certain things, hormonal imbalances, childbirth, postpartum, all this, then lubrication will be part of your life. And they do not treat the root causes. That is very important. And of course, we say that water-based gels are preferred, or water-based lubricants. They actually prefer the KY gel. I've seen a lot of recommendation on the same. And vaginal moisturizers, kupaka mafuta, they restore hydration temporary. But once you shower and when you're taking a bath, let's avoid using even our soaps inside there. We've said we just clean the outer area, we make sure the lips are clean, because again, they can harbor a lot of bacteria because of the moisture, the heat, and the fact that it's covered most of the time. So it creates a hub for growth of bacteria. So you need to make sure that you are cleaning it. Then after cleaning it, you use a very mild moisturizer. You can use shea butter, you can use coconut oil, you can use cocoa butter, you can even use my butter blend. It's great for kupaka mafuta huko ndani. And again, there are people who prefer natural lubricants like coconut oil or even the baby oils. But the problem with the baby oils might be the alcohol content, especially for the commercial ones. If you can get one that is free from alcohol content, that will be okay, because you don't want to exaggerate or increase the dryness. So of course, the vaginal moistures actually do help, but we have said that they are a temporary solution. And even if for that person who's gotten into menopause, you can do estrogen replacement therapy. It is a thing. If you've gotten to menopause and you're still active, it is a thing, and you want to continue enjoying your husband or your partner, you can do the replacement therapy. It's okay, and it actually helps you better than relying on the lubricants. Sawa. And of course, as I have said, when it comes to the long-term improvement of vaginal dryness, hormonal balance, nutrition, stress regulation, medical evaluation when needed, physical exercise to make sure that you strengthen your relaxation and contraction of your pelvic floor muscles is a great solution, or it is a great thing to have as a solution to your dryness or lubrication issues. So remember to seek professional help if the dryness is too much, it is too painful during intimacy, or you're bleeding and you're actually getting a lot of recurrent infections and UTIs, you present with irregular cycles or any other PCOS symptoms like overbleeding, like no ovulation and such, and also postpartum or menopausal discomfort. It is very important to have a look, to have a sit down, even after seeing your gyna, because I know most of us will go to the gyna and will ignore the nutritionist until things get really, really severe. Let's work with a dietitian and also get hormonal assessment if and when necessary. I hope we are together. Remember to stay subscribed, because I think we are going to continue this conversation, especially on the nutrition, that we can have a deeper conversation with Grace on the same, and how nutrition can actually help you manage and control vaginal and reproductive health. So yes, when you improve your vaginal health, you also improve your sexual vitality and confidence. Most women get esteem issues. Mtu anaogopa hata kulala na bwanake because they're scared of being dry. So let's look at holistic approaches like improving hormonal balance to improve libido, promoting better blood circulation to promote arousal, reducing discomfort during intercourse by avoiding all those things tumesema za kuinsert unnecessary things, to ensure that we restore our confidence, and also trying as much as we can to connect emotionally with our partners, because as women, in as much as we want to be physical beings, we are emotional beings, and this actually helps improve intimacy. And one thing that I want you to remember is that intimate health is part of being healthy. I have been seeing a lot of this meme going around whereby they say, if you don't get horny, if you don't get aroused, you're not healthy. So I hope that this conversation, you got something from it, and make sure that you subscribe so that we can continue the conversation next week, same place, same time, not 1 from 11. I'll see you then. Bye. And remember to leave questions in the comment sections if you have any I'll be glad to address them. Bye.